left, Melissa DeRosa, Secretary to the Governor. To her left, Robert Mejica, Budget Director. Thank you for being here. Let us go through some updates for today so everyone knows where we are and what we're experiencing. As you can see, the increase on the trajectory of cases continues to climb, 7681. A couple of updates that I would like to make to the local health providers. We want to anticipate this situation. We talked yesterday about planning forward, getting ahead of it, that we have been behind on this virus from day one. And rather than be reactive, be proactive, get ahead of it. Local health providers should be watching what's going on in different parts of the state and anticipating what's going to happen. This is going to be a phenomenon of a rolling apex. We keep talking about the apex, the top of the curve. But the top of the curve will occur at different times in different places, right? The curve is a function of the rate of spread, the rate of density, and when it started. So you'll see different curves. You see it all across the country. It started in Washington, the state of Washington. Now you see New York, you see Chicago, you see New Orleans, you see parts of California. So that rolling apex is happening across the country. That rolling apex is also going to be happening across the state of New York. The current projections all say New York City will face the first high water mark, if you will, high tide mark, the height of the curve. But then you'll see Westchester, you'll see Long Island on a delay with their curve hitting a new height. Model projectors are not sure if it's Westchester first or Long Island first. Some suggest it's Westchester because we had that cluster in Westchester, if you remember, at New Rochelle. And then upstate New York. We expect a curve in upstate New York also. May not be as high, obviously, as New York City, Westchester, Long Island, but there will be a curve. So if you are not in a highly affected health area now, that doesn't mean you're not going to have a real situation to deal with, because these numbers are just going to continue to go up all across the state. So for a local health system, this is a new challenge. Most health systems have public hospitals, and then they have private hospitals or voluntary hospitals. And they basically exist on a day-to-day basis as two different systems. So you'll have public hospitals, and then you have the private hospital system. And for all intents and purposes, in normal operating procedures, they operate as two systems. There's very little interaction. There's also very little interaction among individual hospitals, sometimes even within their own system. So you have public hospitals that are part of a public hospital system, but each hospital basically operates on its own, right, has its own identity. Certainly true on the private side, where you have individual hospitals and they operate on their own. We have to change that mentality, and we have to change that mentality quickly. No hospital is an island. No hospital in this situation can exist unto themselves. We really have to have a new mentality, a new culture of hospitals working with one another, both within the public system as well as the private system. And we need to think about the public system working with the private system in a way they never have before. There is an artificial wall almost between those two systems right now. That wall has to come down. That theory has to come down. This is going to be all hands on deck. This is everybody helping everyone else. One hospital gets overwhelmed, the other hospitals have to flex to help that hospital, and vice versa. We have Elmhurst Hospital, for example, in New York City, that is under stress the number of cases in the Elmhurst Hospital is high. When the number of cases is high, the stress on the staff is high. I was just speaking with Dr. Zucker about this. You do this for 2, 3, 4 weeks, the level of stress is very intense. Elmhurst Hospital is part of a public health system of about 11 hospitals in New York City. That system has to work together, and those hospitals have to work together. The 11 Health and Hospital in New York City, the public system. And I'm going to ask Mayor de Blasio and Controller Stringer to take a look at the system and figure out how we can get that system to work better together as a unified system. This is not going to get better soon, right? So Elmhurst is under stress now. That stress does not abate for this foreseeable short-term future. So how do we make that system work better together? And what recommendations do we have to improve H&H? We'll also be meeting with the private hospitals in New York City that are organized through something called the Greater New York Hospital Association. I'm going to be meeting with them tomorrow to talk about having those hospitals also organize, act as one, get out of their silos, get out of their identities to work together. And then overall, you have these local health systems. The state's role, which we've never really done before, is getting those health systems to work with one another. So we talked about if New York City gets overwhelmed, we'll ask the upstate systems to be a relief valve for the downstate health systems, which has never happened before to any scale, and also vice versa. There will be a time where the upstate hospitals will be struggling. And when the upstate hospitals will be struggling, then we want the downstate hospitals to be able to take over and relieve those hospitals. That's actually the advantage of the rolling curve that they're projecting. If it does happen that way, theoretically, I almost think of it as a high tide mark, right? High tide comes first in New York City, then the tide is on the way down, and then it's high tide in upstate New York. Okay, so if the tide is dropping downstate, then you have some relief for the upstate hospitals. We put in place the New York Pause program. Today I am going to extend it to April 15th, the directive that non-essential state workforce continue to work from home. We're doing it in 2-week intervals because every day is a new day, and we'll see what happens day to day, but I think it's not even questionable today, but that we're going to need 2 more weeks of non-essential workers. Good news, Wadsworth has developed the New York State Department of Health has developed a less intrusive saliva and short nasal swab test. I'm not exactly sure what a short nasal swab test is, but my guess is it wouldn't apply to me. It can be administered in the presence of healthcare workers. It requires less PPE. Healthcare workers can self-administer it. So kudos to the Department of Health on that. It also helps them limit the exposure for healthcare workers, and it should start as soon as next week. People ask, when is this over? I think the testing, you tell me when they come up with an inexpensive home test or point-of-care test that can be brought to volume. I think that's probably when you see a real return to normalcy in the workforce. In other words, we're all talking about this curve, flatten the curve. At what point on the other side of the curve do you go back to work? Jesse asked this question the other day. There is no answer. I think the answer is going to be in testing. Dr. Fauci, who I think we're so blessed to have him here at this time, he talks about faster, easier testing. If you can test millions of people, if you could test today millions of people, you could send them to work tomorrow, right? So the development of these tests, I think, are very important and instructive. Tomorrow, the USNS Comfort is coming. That is about 1,000 bed capacity. It's staffed by federal officials, federal medical professionals. It is not for COVID patients, but it is to take the backfill from hospitals. Current stockpile, we're still working to purchase and equipment all across the globe. We have a whole team that's working 7 days a week. Unfortunately, we're competing against every other state in the United States for these same things. So it's very hard, but we're making progress. In terms of finding staff, that's going very well. The volunteerism of New Yorkers, God bless them, we're up to 76,000 healthcare workers who have volunteered. 76,000. 76,000 people who volunteer to go into these hospitals at this time. Just think about that. On the total people tested, we did 16,000 last night. Total of 172,000 tested. That's the highest in the state, highest in the country, I'm sorry. Positive cases, 7,000 last night. Total cases, 59,000. The virus continues its march across the state of New York. Only 2 counties now that don't have cases. These are the overall numbers. 59,000 people tested positive, 8,000 currently hospitalized, 2,000 ICU patients, 3,500 patients discharged. Nobody really points to these numbers, but this is good news. 846 people came out of hospitals yesterday, discharged, after being treated for COVID, right? So, yes, people get it. 80% have either self-resolve or have some symptoms at home. 20% go into the hospital. Majority of those get treated and leave. It's the acutely ill, by and large, who are the vulnerable population. And that's what we're seeing more and more. The deaths went from 728 to 965. What's happening now is, as I mentioned yesterday, people are on the ventilator longer and longer. The longer you are on a ventilator, the less your chance of ever getting off that ventilator. And that's what we're seeing. And we will continue to see the number of deaths increase. In terms of most impacted states, again, New York is still number 1. Total new hospitalizations, these are the charts we look at every night. The number is up, 1,175. It was 847 the night before. These bounce night to night. Any one night's data could have a number of variables in it. What hospitals actually reported, when they reported it, how accurate they were. So more you look for a trend line more than anything else. And there are trend lines. If you look early on, the hospitalization rate was doubling every 2 days. Then it doubled every 3 days. Then it doubled every 4 days. Now it's doubling every 6 days. So you have almost a dichotomy. The doubling rate is slowing, and that is good news. But the number of cases are still going up. So you're still going up towards an apex, but the rate of the doubling is slowing, which is good news. Change in daily ICU admissions. You see a tick up in the ICU admissions, but again, you look for the trend line among those columns more than the individual columns. Change in daily intubations. We don't normally run this chart, but these are the people who are most seriously affected. And again, you see a trend line in that. You see some aberrations, March 26th, the 290, but you see a trend line. And the trend line is what we're watching. You also see a trend line in people being discharged, okay? And this is a dramatic trend line. So people came in, they started to get treated, only March 18th, right? So we're only talking about 10 days. They started to get treated. A few of them got out early, a few more, a few more, a few more, a few more, and now you're seeing the discharge number trend way up, because that's what's going to happen. People go into the hospital, they get treated, they leave. Those that are acutely ill get put on a ventilator, and then it's the inverse dynamic. The longer they're on the intubator, the longer they are intubated, the longer they are on the ventilator, the higher the mortality rate. Again, perspective, these are the numbers from day one since China started. Also, we should all keep in mind, we lost the first responders who go out there. I was talking about the 76,000 people who volunteered to help medical professionals. Being a first responder today, being a public health official, working in a hospital, working with senior citizens, this is really an act of love and courage. We lost Detective Cedric Dixon, 48 years old, 32nd, 23-year veteran, could have retired. So we wish him and his family peace. We lost a nurse. We've lost a couple of other nurses. Kaios Kelly, 48 years old, who was the assistant nurse manager at Mount Sinai West. We wish his family the best. These public people, I don't even have the words to express my admiration for them. FDR always had words. Courage is not the absence of fear, but rather the assessment that something else is more important than fear. To me, that says it all today. Everyone is afraid. Everyone is afraid. You think these police officers are not afraid to leave their house? You think these nurses are not afraid to go into the hospital? They're afraid. But something is more important than their fear, which is their passion, their commitment for public service and helping others. That's all it is. It's just their passion and belief in helping others. And that overcomes their fear. And that makes them, in my book, just truly amazing, outstanding human beings. And I wish them and their families all the best. The President and the CDC ordered a travel advisory for people of New York, New Jersey, and Connecticut. This happened last night. This is not a lockdown. It is a travel advisory to be implemented by the states, in essence. It's nothing that we haven't been doing, right? Non-essential people should stay at home. So it's totally consistent with everything we're doing. And I support what the President did because it affirms what we've been doing. It also affirms what New Jersey and Connecticut have been doing. Rhode Island issued an executive order that New York license plates would be theoretically stopped at the border for mandatory quarantine of some period. That executive order has been repealed by the state of Rhode Island, and we thank them for their cooperation. That was repealed last night. Personal opinion, not fact, gratuitous. This is disorienting. It's frightening. It's disturbing. Your whole life is turned upside down overnight. To the best you can, you find a way to create some joy. You try to find a silver lining in all of this. How do you break up the monotony? What do? How do you bring a smile to people's face? I'll give you my idea for today. Sunday, I come from an Italian-American family. Sunday was family day. We had the big family dinner, but you'd have like in the afternoon, so it was like a confusing, but it was like a lunch, late lunch, they called dinner, and it was spaghetti spaghetti and meatballs and sausages, and my family would all get together, and it was a beautiful time. I didn't really appreciate it as a kid, but it was just beautiful because they all came together, and the grandparents were there, and they would start to eat at 2 o'clock. It was like a marathon session. The food was really just the attraction to get people together. You know, everybody talks about how the Italians love the food. That's true, but really they love bringing the family together, and the food was the way that people came together. And then you sat at the table, and it was just a 2-3 hour affair. My mother and father did it also. Not to the same extent my grandparents did it, but we had that same Sunday dinner around the table. I tried to continue it as a father with my kids. I was divorced, and so I'm not